Hello and welcome to today's edition of Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with Zimbabwe's COVID-19 effort, as well as giving you regional and international trends around the pandemic. My name is Blessing Munatsi, and this program is made possible by ZTN's partnership with the Ministry of Information, Publicity and Broadcasting Services. As usual, we start by taking a look at the latest figures released by the Ministry of Health and Childcare. Yesterday, 30 new cases of COVID-19 were recorded from 2,564 tests that were conducted, and this represents a 1.2% positivity rate, takes the number of active cases to 574. Single death was recorded, taking the number of fatalities to 4,679, and the cumulative number of COVID-19 cases now stands at 133,007, and of these 127,754 are recoveries, equating to a recovery rate of 96%. Zimbabwe currently has 44 hospitalized cases of COVID, 2 of them being new admissions, 12 asymptomatic, 24 mild to moderate cases, while 3 of those admitted have severe symptoms and 5 are in the intensive care unit. Now moving on to the vaccination program, 6,435 people received their first dose yesterday, brings the cumulative for the first dose to 3,317,010, while 5,294 received their second dose, to bring the cumulative for the second dose to 2,600,453. Now, in an interesting latest development, the Minister of Information, Publicity and Broadcasting Services, Senator Monica Mchangwa, addressed the media this afternoon, shortly more than 30 minutes ago, giving an update on the status of the national lockdown. And the level 2 lockdown is extended for another 2 weeks by the acting president of the country, Dr. Constantino Chiwenga. And in the briefing, Minister Mchangwa did note that the last 2 weeks have seen a reduction in the average number of new COVID cases to about 45, and this being attributed to the measures that government is taking. Let's hear her speak.
The last 2 weeks has seen a reduction in the number of cases of COVID-19, which has resulted in the country recording an average of 45 new cases per day and an average of 1 death per day. This indicates that the lockdown public health measures which are currently in place are effective in controlling the transmission of the virus. In this regard, the level 2 national lockdown is hereby extended for another 2 weeks by the acting president of the Republic of Zimbabwe, Honorable General Retired Dr. CGD Chiwenga. Globally and nationally, public health discussions have been ongoing regarding extending vaccinations to children and other special groups such as pregnant and breastfeeding mothers. Based on the available scientific data in line with Medicines Control Authority of Zimbabwe, specialist pediatricians have recommended the vaccination of the 16 to 17 year age group with the Sinovac COVID-19 vaccine. The protocol for the below 16 age groups is still under consideration. The public is hereby advised that the COVID-19 vaccination for the 16 to 17 all the provinces, secondary schools, colleges, universities, and vaccination centers are hereby required to commence the vaccination campaign of this age group with immediate effect. For the avoidance of doubt, the only vaccine type eligible for this age group is the Sinovac COVID-19 vaccine. The government of Zimbabwe, through the Ministry of Health and Childcare, is determined that Zimbabwe achieves herd immunity by end of December 2021.
That's Minister Monica Mchangwa there addressing the media, and the new development is that the lockdown has been extended by another 2 weeks. But an interesting development also is the inclusion of the 16-year and 17-year-olds in Zimbabwe's vaccination campaign, and this is actually being rolled out with immediate effect. And to note also is that the choice of vaccine is the Sinovac vaccine, which is consistent with the WHO recommendations. It seems to have safer profiles, even being recommended for use in pregnant women and also lactating mothers. Now, with the Zimbabwe coronavirus infections going down, the danger is with the complacency that is creeping in amongst the members of the public. And we did get in touch with Zimbabwe's chief coordinator to the COVID-19 response, that's Dr. Agnes Mahomva, who did highlight that we need to keep the fight against the pandemic ongoing if we are to avoid a fourth wave.
It's our usual. We're so fortunate that we've learned lessons from the 3 waves that we have had. We are so aware every single time we're out of a wave, people get complacent, and then we continue pushing for people not to be, and this is one of the reasons why we are pushing vaccination, because we are aware we will always have a few people who will be complacent. If people are vaccinated, then they are protected as individuals, as their communities, and as Zimbabwe in general.
Okay, let's take a look at what's happening around the globe. Today we're in Tonga, where for nearly 2 years the remote Pacific nation has avoided the global pandemic that has infected hundreds of millions of people and left others dead. The streak of good fortune ended this Friday when that country did record its first coronavirus case. The infected person actually arrived in Tonga on a commercial flight that left Christchurch in New Zealand on Wednesday, and the Ministry of Health has actually confirmed that development in a statement, and Tongans have been rushing to vaccinate themselves against the COVID-19, and the infection was detected in a fully vaccinated person who arrived on a repatriation flight from New Zealand. And Tonga's Prime Minister Pohiva Tionutoa warned that residents of the main island of Tonga Tapu face a possible lockdown next week. Tonga was one of the last countries not to have recorded any COVID-19 infections over the past 2 years, and over 100,000 people live in the island nation located northeast of New Zealand. As noted there, the first case came with someone who traveled from outside the island, and this person also happened to be vaccinated. And over the past few months, there have been debate on some countries in Europe published a list of vaccines that qualify for exempt travelers from quarantine. The issue really of vaccine passports is generating a lot of debate. Could this be just another technical barrier that is being used by countries to bar immigrants from coming into their countries? Well, policymakers and public health specialists are advising governments worldwide and have been exploring the potential of vaccine passports in order to allow more freedom when it comes to international travel. This move has actually attracted concerns due to several challenges and perceived ethical issues. And the World Health Organization, the WHO, Chief Scientist Dr. Sumia Swaminathan gives us the current position regarding this issue.
One of the reasons for the high amount of stress that people who've received vaccines which are not yet approved either by WHO or by any of the other main, the stringent regulatory agencies, is because of restrictions in travel that have been imposed. And I just want to reiterate that the emergency committee that reviews the international health regulations met again last week. They meet every 3 months or so to review the status of the pandemic, and have again reiterated, they have underlined their previous recommendations that countries should not use vaccination status or selective vaccination status as the sole criteria for entry for travel. So you could use a vaccination status, but also a negative test prior to entry or proof of a previous test, and many countries accept one or the other. And therefore vaccination status should not be a barrier to global travel, because that is just actually increasing the inequities around the world. There are large parts of the world where people do not have access to vaccines, or who have received a vaccine that's not yet approved by all countries, and that should not be the criterion whether that individual can travel to others, because there are other ways of minimizing the risks.
So there you have it there. Technical barriers around travel between countries should not actually be abused by countries. In fact, the United Nations World Tourism Organization, the UNWTO, also has raised its concern because the COVID-19 pandemic has actually hit the tourism industry quite hard, and the issue of these vaccine passports could actually exacerbate the loss of travel between source markets even further, but we did get that clarification there from the WHO chief scientist, that's Dr. Soumya Swaminathan. And diplomatic passport comes to an end for today. We're back again tomorrow, same time. Do make a date with us. My name is Blessing Munati. It has been an absolute pleasure. And this program is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. Until we meet again, it's goodbye for now.